So what do you have in Inclisiran? What do you understand from the recent trials which are available in Inclisiran? Inclisiran has a good number of trials. We have a recent Orion series, which is 9, 10, and 11, where they used in patients with familial hypercholesterolemia and atherosclerotic cardiovascular patients and patients who have an atherosclerotic cardiovascular risk and risk factor equivalence across the globe. The trials have run for close to 1.5 to 2 years now. The data is pretty good. You could see a 50.5 reduction in the LDL levels, which is sustained, and you could see a 50.7 effective LDL reduction. This is pretty good. I think this is as good as any other lipid lowering therapy you will use for patients with atherosclerotic cardiovascular risk. So whenever you see any drug which is available for reducing LDL levels, the one big question arises, does this have a cardiovascular data? So now we have enough and more data to support the primary importance in patients with atherosclerotic cardiovascular disease is reduction in LDL. Early days, when we are looking at statin as a drug, there are a lot of talks about pleomorphic effects of statins, where you thought that statins had effects more than LDL reduction in bringing down the atherosclerotic cardiovascular risk. Now we have data on ezetimibe. Now we have data on bempedoic acid. Now we have data on other PCSK9 inhibitors, which have clearly shown in patients with atherosclerotic cardiovascular risk, the more and primary importance is reduction in the LDL levels. So if you have any drug which is going to reduce LDL levels, it's definitely going to have a cardiovascular benefit. That's implied. So that's the reason, although Inclisiran right now does not have a lot of data on cardiovascular MACE reduction, we know very well you are going to have a significantly lower LDL levels. You are going to have a better data. The biggest advantage what we see with Inclisiran is, along with the significant reduction in LDL, there's close to around 41% reduction in the LPA level also. There are very few drugs which we use for lipid lowering which has effect on LPA. Inclisiran is one drug where you could see a close to 41% reduction in the LPA levels also.